Speech mapping is used to verify speech audibility when fitting hearing aids. Performing speech mapping increases the chances that your hearing aid programming will be done correctly on the first try, reducing the likelihood of frequent follow-up appointments. Speech not only provides a real-world verification signal, but it is also effective in demonstrating the effects of hearing loss and validating the benefits of hearing instruments with patients and loved ones. During speech mapping, stimuli are presented through a loudspeaker and hearing aid output is measured in the client's ear. A visual representation of the hearing aid output is displayed on the measure software screen. This is not only useful for the clinician fitting the device, but in demonstrating to the patient what they can hear and what sounds they may still have difficulty hearing with their hearing aids. In this sense, speech mapping can be used for verification as well as a counseling tool. The speech mapping measurements in Measure are fully customizable and automatized. In the Measure Sound library, you'll find a range of pre-recorded, real-world speech stimuli. You can also record your own or use live speech. When using live speech, not only can the clinician use their own voice for verification, but they can also allow patients' loved ones to participate. Verification does not get more patient-centered than using a loved one's voice. To begin speech mapping in Measure, select the Speech Mapping module, then click SM Measurement. Under Test Types, select Speech Mapping. You can opt to view targets based on a variety of hearing aid algorithms. Here we used NAL-NL2 and set our peak target offset at 10 dB. You can then set your intensity level and desired speech stimuli and hit Start. Measure will guide you through the measurement with prompts on screen. Hit the Stop button to end your speech stimuli when you are happy with your measurement. You can then save and close the speech mapping screen.